Okay, it's a couple of minutes past 7 now, so we'll get started. There might be a few more students that join as we get going, but we'll just crack on because we've got quite a bit to fit in the next couple of minutes. So if we want to move to the first slide, I'll just go through a quick introduction part. That's great. Okay. So today we're going to be looking at do you have what it takes to be a medical student? And there's a couple of reasons why we were kind of looking at this topic. For some people, it's medical school interview season now, and you know the interviews are one of those things where they're looking to find out if you have what it takes to be a medical student. That's essentially what they're asking themselves, and the admissions tutors are asking when they invite you to an interview. So we wanted to kind of approach it from that angle. But for the students that are not taking their interviews and they're maybe applying in a year or two time as well, it kind of gives you a bit of a framework for some of the skills that you might need to work on over the next few years as well. So just to introduce myself as well really quickly, my name's Mark Williams, the founder of Medical Projects, and we've been helping students with their medical school applications for the last kind of 5 or 6 years. And later I'm going to be joined by Dr April Diviney, who has done lots of webinars with us before and has also taught on some of our courses as well. So she's got a lot of great kind of advice and experience for you. We always try and keep it super brief with the discussion part, and then we like to try and leave more time for your questions because we appreciate that you have a lot of questions, and quite often that's more useful than us just sitting and talking at you for an hour. You know, that's not going to be very interesting for you. We'll send all the slides out later, so you can always refer back to these, but we want to give you a chance to ask all the questions that you want to ask as well. So if we just have a look at the next slide, there's a couple of housekeeping things to go through. As I said before, we will send a recording of the slides, a recording and the slides out within the next couple of days, so you don't need to kind of furiously take notes. We will have a Q&A section at the end, and when we do the Q&As, we have or we use the upvote system on Zoom. So if you haven't used Zoom before, down at the bottom bar, there's a Q&A function. And if somebody's asked a question that you wanted to ask as well, there's a little thumbs up button on there, and it essentially votes that question to the top. It just means that we can see the most popular questions first, and it means that we can try and answer the most popular questions as well. We do have a couple of poll questions. I think we actually just one poll question tonight, so get involved as well, and feel free to ask lots of questions towards the end. So I'm just going to quickly put up a poll. They're all anonymous, so we'll just give you a second to have a vote on that. Essentially, we just want to know how many people are coming back and watching our webinars all the time. How many people, it might be your first webinar with us, and that's great. So it just helps us kind of work out if people are coming back and people are enjoying our webinars. We'll just give that another kind of 10 seconds. Cool, so I'll just quickly share the overall results. So half of the people on here tonight, half of you guys, it's your first webinar, which is fantastic. Welcome. If this is your first one, you can watch all our old webinars on the YouTube channel or on the website as well. So if you do like this, you can go back and watch some of our other webinars. And then there's quite a good range. So the other 50% have watched at least one other, which is amazing. So welcome back to all of you. We really hope that you find these enjoyable, and we hope that you find this one as useful as well. Okay, so we'll move to the next slide. And this is the time to welcome Dr. April Diviney. Hello, how are you?
I'm good. I'm on night shifts this week, so I'm the night bird.
Yeah, so obviously your night shift starts at what, 8:30? So we have to be super kind of compact with this webinar tonight, don't we?
Yeah.
Okay. Just as a super brief introduction, for the guys. Obviously, you're an IMT1 doctor in the hospital now. Do you want to just like super briefly explain what that means?
Yeah, so IMT stands for kind of internal medical trainee. So it's training to be a consultant, like specifically in medicine. So medicine is like hospital based, but you can then kind of further subspecialize to so like different types of medicine specialties are like cardiology, neurology, respiratory, care of the elderly, dermatology and things. So they're kind of medical specialties. So I'm starting on that kind of process to train and be a specialist in one of those.
Okay, excellent. Thank you for that. So tonight you're going to talk to us about what it takes to be a medical student, or some of the key qualities that students need to have to be, a good medical student, aren't you?
Yeah, and I've kind of broached this, and I know Mark's kind of said these are all kind of skills that you'll be able to talk about in interview. But I think also importantly, they're really important for approaching it from kind of how to take that 5 or 6 years and make the most of it. So that's kind of how I've approached kind of doing the information and the advice side of things.
Okay, sounds good. Well, I'll let you crack on, given we're super time pressured this evening.
Cool. So yeah, I do apologize. I'm a little bit, normally I can carry on talking for like over an hour and things, but unfortunately duty calls this week and I have to leave my house at like 8:10. So fortunately I live close to my hospital, so it's good. As I said, and kind of talk through different skills that I feel are quite important for you to know and be aware of. If you've got these skills, it does make your life easier in medical school. And then ultimately makes your life easier as a doctor later on. And yeah, one of the big first things is organization. Yes, organization. Start now. The better organized you are, the more aware of when your assignments are. And I know it sounds really silly and it sounds really obvious, but people that aren't organized, and I'm sure some of you are like, oh yeah, like, oh, I've got this assignment and it's due in like next week and I knew about it for a month. You're going to be, if you're more prepared and know when it is, maybe you can do like a little bit when you first know about it and then do a little bit further on. Whereas if you're cramming it in all in the night before, some people miraculously get like amazing marks doing that. I was never able to do that. But what I would say is just kind of really be organized. Like I've got so many to-do lists on my phone now because it's just essential when you're a doctor to be organized. You've got to know when where your patients are, when they've come in, what blood tests they're like. So consultants might be like, oh, what was their like blood test from 2 days ago? And you're like, oh, okay, yeah, I've got to remember to do that and remember to do this. You've got like big to-do lists and things. But yeah, this is like, this is really important even when you're at med school. So there is a lot that happens during med school. So you've got your lectures, and as I said, especially if they're online, I'm sure you're aware that a lot of university study is changed to online learning. Not all of it, because parts of medical school, like I've had third year medical school students come onto my ward the last at least 2 months. So they're making sure that learning from that side of things is carrying on. All the lectures, you've got seminars, you've got seminar like assignments. I'm sure you'll have kind of coursework assignments for some things, or you might have research assignments depending on what university you go to. And then you'll have to know when all your exams are. So being organized from that is really important. And it actually leads you to know when you can have time off as well. So if you know that, oh yeah, your exams are not for another 2 months and you're on top of things, you give yourself a couple of days off, have some time to yourself, because that's really important as well. Cool. Right. So this was something that took me ages to understand. And this is the same with, you now with, especially at med school, you're learning, there is so much to learn. It's unreal. I think the content level in med school is the bit that I struggled with. Because you've done elements of biochemistry, probably, you've done elements of biology, chemistry, physics, maths, like you're smart people, hence why you're kind of looking at this course for your career. And it's just really understanding that you really actually can't learn everything at once. It does take time, hence why the course is so long. And I think one of the best things I was ever told about by one of my tutors at med school is that they kind of put things in different levels. They said, right, there's stuff you need to know, there's stuff that's nice to know, and there's stuff that you probably don't really need to know. So all the need to know stuff is like the curriculum stuff that's definitely going to come up in your exams, stuff that's like all the basic physiology, the drugs, the anatomy, things like that you definitely need to have in your head. Then there's stuff that's nice to know. So it might be stuff that's a bit more clinical if you're in your early years, or if there's might be more kind of rarer conditions that you think are relevant. So it's not essential, but it might get you that kind of extra couple of marks, or kind of that extra couple of bits of knowledge that make you totally understand what's going on. So it's like just that extra step up. And then there's stuff that's like consultant research, like level stuff, that's the stuff that you start off in first year medical school being like, oh my gosh, I need to understand all of this. But there comes to a stage when you realize it's not going to come up on your exam. Yes, there's a lot of stuff that you do need to learn, but then it takes you some time sometimes to understand. So I kind of broke that up into the 3 categories. And once I did that, I was just like, oh, okay, I know it's going to come up on my curriculum. I know what I really need to learn. And then can you take it from there? Because that, that bottom point there is really valid. You're not a consultant yet. You're not, a research theorist. You're not, you're not there yet, but you're still learning. And that's what's really important. Yes, you'll get there, and it's understanding, you will get there. So not, it can be quite a lot of pressure sometimes for people. Yes, know when to ask for help. I say this from experience, unfortunately. Really, and we say everyone needs a bit of help sometimes, and that's from anyone, whether it's your friend, whether it's someone you live with, whether it's someone that's in your seminar class or your lecture class, even if it's just like, oh, I don't quite understand that. What did they mean? Asking is the thing that clarifies the knowledge behind it. Because if you don't understand, you're not going to then be able to develop it. So if you don't understand it at first year, when you go into second year, you're going to be like, oh, I thought I understood that, but I didn't really. So I don't know how the drugs relate, and I don't know how that relates to the symptoms. So really do ask for help from anyone that you want to ask for help from. In some universities, they use this buddy system, or a mummies and daddies system. So I had 4 people in the year above who were like my mummies and daddies. They were in second year med school when I started, and they were just there as an element of support, whether it was oh, where's the best place to get your bits of groceries, or how does that work at uni, how does the library work. It's those little questions that you need to be able to ask someone. And sometimes just asking someone from the year above, whether it's silly questions, is always quite helpful. But yeah, your tutors are there. There's so many kind of staff members that are there for support. If it's that you think that you're not quite that you're struggling a little bit, or that you need some help with mental health or anything like that, there is support there. there's loads of different departments that you can get access to, and usually there's like a head of year and things like that you can talk to if you feel like there's no one else to turn to. So there is help, and definitely ask for it. And as I said from this experience, I like failed one of my research modules because I did not understand. I can't write essays. I didn't ask for like any help, and of course I like failed and had to like get pulled into a meeting and things. It was so horrific. So yeah, definitely ask for help. And this is so valid. University, like if we're talking about this in interview, even if someone are asking, about a difficult scenario and a difficult situation, there is always that option to ask for help. If you're saying that you're a med student who's in a difficult way, you can say that, oh, I'd ask for advice as well, because that is what would happen when you're a doctor. There is always people there to ask. So yeah, definitely ask. Right, teamwork. So massive buzzword, and I'm sure if anyone's in the process, if anyone's in like year 12 or like equivalent for other countries, teamwork's really essential. And it sounds silly, and you're like, why are you suggesting teamwork in medical school? Because surely I'm revising on my own and I'm doing all this. But that's where things start to kind of kick in for developing your teamwork skills. And I say this because mainly for revision exams and like practical exams, I honestly wouldn't have made it through. I had like 2 friends for like my finals, we revised like solidly for like a month together. We were practicing exams on each other. We were like asking each other questions constantly. All my housemates as well, we were all there and like revising all together. If anyone had any questions about upcoming exams and topics, we all went through it together. I know it sounds really silly and you're like, oh, of course I'd like discuss it with my housemates. Some people take themselves off and revise privately, which is fine, and it does work for some people, however revision works best for you. But especially with like practical exams, it is very useful to get, practice makes perfect. So if you're practicing on each other and then you have real life on a patient and a simulated patient, then that's, you're already slick and you already know what you're doing. Yeah, essential for being a doctor, because I'm sure it's not a one-man band in a hospital. It's not a one-man band in a GP or a surgery or anything like that. So as soon as you're already working well as a team, now in university, you're already kind of set up to work well with people when you're a doctor. So you know when to kind of play off each other's strengths and play off each other's weaknesses, and then get certain people to do things and you to do other things. So it kind of sets you up for that. And yeah, like essentially any job really, isn't it? Not just kind of healthcare. So whatever you want to do, teamwork. Right. Okay. Learn to accept criticism. So this was a big thing with, this will be a big thing in kind of like in med school, and especially if you have like communication skills classes and like exam feedback and things. You are going to get some sort of criticisms, and whether it's positive criticism, I know that it's a bit backwards, but like positive feedback or negative feedback, you need to be able to like learn how to like reflect on that and change for the better. And that's the whole point of certain classes that you have in university. You kind of talk to each other, talk to simulated patients, and then learn how to communicate better, learn how to do better in exams, and you get kind of honed into like a really good way of phrasing things and way of talking to patients. So like as soon as I started my like first year as a doctor, I was just like, oh, okay, yeah, I can communicate quite well with people. And genuinely I think it was because of the classes that I had at uni. and that was purely because people would be like, that sounds rubbish, don't say it like that. Like, I know they're supposed to say it in a nice way, but everyone kind of, they do joke about it a bit. It's your colleagues that you're doing it with. There will be tutors there that kind of say, oh, maybe don't do it like this, maybe change it and do it like this. Or if you're in your seminars and you might be presenting, they might be like, okay, we didn't quite understand that, maybe rephrase it. So it sounds quite subtle, but actually when you're doing that for 5 years in a feedback process, it does, if you're accepting the change, then it does make you better. You know, even the knowledge, if you go onto a ward and one of the consultants asking you a question and they're like, oh, you know, maybe you should have done this when talking to the patient. It's just those little things that are constantly making you learn and making you better. So really, you know, don't be embarrassed by it and really just get stuck in, because that really is the best ways to learn. And yes, if someone's being really like nasty to you and really like having a bullying nature, that's not right. But criticism is a part of kind of like a feedback process. So our positive feedback, our improvements, you know, there is certain ways of giving feedback, and you know, that does help you improve. Okay, I think we're coming to, yes, I think this is our last one. So I know we talked about a few points and I know they sounded quite brief, but I wanted to kind of like end on, you know, quite a positive thing as well, because you might be thinking, oh gosh, I'll be doing this and I'll be stuck in exams and I'll be doing this in lectures. Oh gosh, she's like stressed me out. But actually, like these tips are trying to get you to have that time to enjoy yourself, because, you know, you are there at uni to have that time, you know. Some people go to uni more than once, but some people only go to uni once. So, you know, really do make the most of it. There's so many ways to make friends, make new friends, meet old friends, join in societies. There's like quiz societies and language societies, art societies. And really, you know, there's things that you can kind of wind down from medicine. There's loads of different ways to kind of de-stress and enjoy yourself. There's loads of stuff to do, and really, you know, do get stuck in, and there's loads of opportunities to get kind of especially with societies, if you could become like a leader or organizer of a society, you can get it kind of gives you like bonus points later on in your career and things. So yeah, that's why I say like just get stuck in. Don't overload yourself. If you know, you still have to have, if you'd like a bit of telly, like a bit of Netflix, but you need that hour to yourself as well. But you know, do get stuck in. You know, my friends from uni I'm still good friends with, and still playing the sports I played in university. So yeah, honestly, really do make the most of it. And
I think that's some really, really good advice. And I think that advice is really applicable even if you're GCSE level now or AS level now. They're the same skills that you're going to take all the way through to being a great medical student and a great doctor as well. They're just universal, aren't they?
Yeah, absolutely. Like, and they're not necessarily medicine specific as well. I think that's what uni courses are there for. They're there to develop you as a person, they're to develop your knowledge. And I think no matter what kind of, if you don't end up going into medicine, I still think that these like skills are valid, like being organized and being a good team worker, being able to take criticism and all of that. Like that's, you know, actually enjoying yourself in life. They're all really important things.
Yeah, absolutely. Again, I know we're time pressured, so I think we've got maybe like 17 minutes. So we're going to try and like fire through as many questions as possible. If everybody wants to use the actual Q&A function, now's the time to kind of throw some questions in there. I'm just looking at the first two, and I'm actually going to answer these because I've got some really good resources that we've done in the past that help answer these. So Melika's asked, have you got any advice for the current situation for work experience? We actually did a webinar maybe a month ago about how to find work experience during lockdown and things. So what I'm going to do, I'm going to share the YouTube link in there, and I'm going to put it in the chat as well, so everybody can kind of copy and paste it from there.
I suppose the only thing to say from that is that obviously we did it a month ago when things were in national lockdown. So things probably are starting to slowly open up. So what I would say just at the end of that, like, do watch the webinar. Everything that's on there is still absolutely valid for now. But what I would say is really do hunt. There are opportunities out there. So do hunt for them, whether they're volunteering in hospitals, volunteering in communities. Really, I think more and more opportunities are coming about now. Things will start to relax a little bit.
Yeah, definitely. I've put that in the chat so everybody could copy and like paste that into something outside of Zoom, because obviously when we close Zoom down, it'll disappear. So save that link. The next question down, it was the second question down, but I'll start answering it anyway, was what books would you recommend for medicine? Again, even in that same link, there's a section in that webinar where we talk about books. So that one's still valid there. And we just did a blog post on Adam Kay's book where we did a review. So I'll put that in the chat as well. So,
yeah, I think the lockdown, like the link for the YouTube one, I think it's about halfway along. I think where if you didn't want to watch it all, but I think it's about halfway along, that it gives you at least like 9 different like types of books to read, isn't it? I think it's a minimum of 9. I think there's like 2 pages worth of different books.
Yeah, so in those 2 links, you've got at least 9 books to go away and read. And there's a review of Adam Kay's book as well that's on our blog. So hopefully that answers those 2 questions and helps everybody with that. Next question is, when do you suggest Year 12 should start preparing for the UCAT/other exams for medicine?
Yeah, and this is a great question because you're being really organized. But that's the sort of questions you should be asking now, especially if you're in Year 12. That's what you need to be asking. You need to be having it on a calendar or in your phone, being like, oh, this is when the application process is. Honestly, that's a really good question. And so preparing for it, it depends on when you want to take it. So I think you can take it from kind of like July, September to September time. It depends on when they're opening up this year. The actual website itself for the UCAT will have the list of dates. And they have got practice questions on there as well. They've got the price systems on there as well. And what I would say is, obviously, if you're taking it earlier, I'd give yourself at least a good 2 months to go through some practice questions. And I say 2 months, it's just so then you can have like maybe 1 evening a week, just to really sit down and solidly a good couple of hours, 1 evening a week or something. But if you're going to do it like a solid month, then obviously you don't have to like do it for then, because you've got other things going on as well. You've got your own exams, you've got your own courseworks and things. So if you want to be uber prepared and want to do like 2 hours in an evening or 1 hour in an evening, start earlier, and then you can it gives you a bit more time then, and you're not as stressed about it. But yeah, it depends on when you want to take it. Same for the BMAT. There's a date in September and a date in October. I think it's 1 date and 1 date from my memory. And again, same for preparation. Practice with past questions. You can practice. They say you can't really revise, but you can practice, certainly. There's so many books out. There's loads of stuff on like the internet that you can kind of get different materials and access to prepare for it as well.
Okay. The next kind of most popular question is from Lily. How do you manage the workload in medical school?
Yeah, it can be a little bit difficult at times, and I think that's why I wanted to let you know about that, like nice to know, like that need to know, nice to know, and like things you don't really have to know. Um, you kind of end up having to. So I went to a PBL university. So I personally found this a little bit easier to dedicate my time because there was a little bit kind of like less lecture time, but more kind of they gave you like a, at one point like a full day of like private study time so you can prepare for your PBL classes. Um, I think you just need to make sure, like for me, I'd come out of my seminar and I'd make a list of everything that I was doing for that week and what I was going to cover for that week. And then I'd be like, right, like Monday morning's my lecture is, but Monday afternoon I've got some study time. So I'm going to do it then and I'm going to work till like 5, 6 o'clock, but then I'm going to go to netball training after that. And then Tuesday I'd be like, I'd kind of set out a little bit of a timetable and be like, right, that's what I'm doing when. And then the kind of like covering the content side of things, you are guided. You're not on your own in medical school. Especially people think that they're on their own even in like PBL universities and things. You are given a curriculum. There is access online to curriculums and things. So you know the gist of what you need to cover. So you kind of can like tick them off and be like, right, I'm going to cover those learning outcomes this week. I'm going to cover those learning outcomes next week. And you are guided through that process from a PBL. Obviously, I can't say that specifically for the integrated and lecture-based, but I'm sure same at lecture-based, depending on the lectures, you're guided through what you need to cover for that week. You aren't left on your own. But you kind of know what to cover, but it's the depth of level of cover. So yeah, that's where that like need to know comes in. So you need to make sure you know what's on the curriculum, then you can kind of delve further if you need to, or if you have time to or want to.
Okay, Madeleine has a question. In an interview, how do you think clearly and articulate your words to represent the best version of you without being caught up in nervousness?
Oh gosh, that's a really good question. It sounds really uh like obvious, I suppose, maybe to some people, but to actually practice interviewing. So I've learned how to speak now after kind of years of practice. And I know maybe some of you might not have years, but I've been able to like listen to myself back. I've been on interviews myself. I've interviewed people. So you kind of even like having yourself I know it might be really awkward, but I'd set up a camera and I'd actually like get someone to ask you questions and you have yourself on camera. So then you'll know how you're sitting, you'll know how you're coming across in your speech, if your voice is shaking or not. And then by doing that over and over and over and over, then you're kind of getting over that nervousness more and more. And if you're looking at yourself and know someone's videoing you, that's to me very like nerve-wracking. Or if you're having like a teacher interview you or the head teacher interviewing you or something, like a ranger or like a family member or a stranger that you don't know, just have lots and lots of people try and ask you questions. Ask the hard questions as well. So if you practice at home with the harder questions, then you'll get to interview with the easy questions and you'll be like, oh, okay, I know what I'm saying here. That's fine. Breathe. And that sets you right again for the next question. And making sure that you are prepared for the questions that you know are going to come up as well. They're like, why do you want to be a doctor? Why do you want to go to this university? What makes you a good leader? What makes you a good team worker? All those like classic questions that come up regularly when you're Googling, what are the regular interview questions? Prepare for them. Don't like sound like a robot, but at least have them prepared. So then if they do ask it, you're like, okay, I prepared for this one. Let's go.
Yeah, definitely. I think it goes back to your first point about being organized, and it's doing that bit of research around what's expected in the interviews and the types of questions that come up. That's going to take away a little bit of nerves because you're prepared. And then, like you say, recording yourself and watching you back, that's almost more nerve-wracking than actually having an interview. That's so cringy. But if you can do that and you can get through that, then the actual medical school interview is going to be so much easier.
Hopefully.
But it will be awkward. It will be super awkward, but
Yeah.
it will really, really help.
Yeah.
Okay, so next question. Any support on how to make your application unique?
It's quite this is quite a common question that comes up, actually, because I think people do worry about how to make it stand out, or how to make it like unique and separate from everyone. All I say to this question is that you are like no one else. There is no one else like you in the world. So surely that's what's going to make it unique, because no one's going to have the same set of skills as you. No one's going to have the same set of experiences. No one's going to be in the same position as you at that particular time. You are your own person and you are the unique individual. So what is it about you personally that makes you the better candidate? What about your skills as a person? Are you a hard worker? Are you a good studier? Are you a dedicated person to studying medicine? Are you a really good communicator? Are you a really good leader? What is about you that makes you unique? And that's kind of, if you're coming across and selling you, and I know it sounds really silly, but that's the whole reason why it's called a personal statement. It's because it's about you personally, and it's about kind of selling who you are and why that university needs to have you in medical school. There will be something about you that, you're thinking of studying medicine. So why is it? You end up reflecting and being like, oh gosh, what is it about me that would make me a really good doctor? So once you reflect on that, and kind of ends up being a bit of a mindfulness moment, that you kind of think, oh, well, what is it about me? What makes me special? Once you kind of figure that out, and there is something there for everyone, then that's kind of what's going to make it unique. I don't know about you, Mark, is there anything you'd add to that?
No, I don't think so. I think you covered all the main points about being unique and being personal. That's the only thing that can be unique, because
Yeah.
your grades and your A levels and subjects and most of your hobbies are never going to be super unique, really. There's always going to be somebody else that's captain of a team here or a captain of a team there or has done a similar hobby. So it's about finding what's unique to your kind of personality traits and linking that back to what's going to make you a great medical student and a great doctor.
Yeah. And I know it's going to be really hard. That's what I found, because the question about why do you want to be a doctor, or why do you want to study medicine, I actually found that really, really hard as a question. And once you kind of understand that a little bit more and understand yourself and why you want to apply, I think that makes it a little bit easier.
Yeah, definitely. And being confident when it comes to your personal statement, your interviews as well, making sure that you can communicate well is going to be so important. People always ask, oh, how can I stand out? If you communicate really, really well, that's going to be such an asset. And whether you communicate really well through your personal statement and hopefully at interview as well, then that's going to really, really help you stand out, really.
And we always end up talking about, if anyone, I've seen some people have seen like 5 or more of our webinars, so they will 100% be sick of me saying this, but there's a whole, and I won't kind of extend the point too much, but there is a whole reflection webinar, and that's kind of when we talk about personal statements and interviews and things, we mention reflection so much, but it's just because that's reflecting on you as a person and reflecting on what makes you a better medical student really does make you stand out.
I'm just really conscious of time. I think we've probably got time for maybe 2 more questions. So I'll ask this first one, and then I'll find one more whilst you're answering that, and then we'll probably have to wrap it up there. So what advice would you give to somebody who is interested in medicine but finds biology hard?
Yeah, I think that's a good question, because it'd be a very similar thing for anyone who finds like chemistry hard, or finds like maths or physics hard, or finds like another subject hard, but they need that to like get through. It's not all biology for medicine. It really isn't. Yes, you need that for some universities to get into medical school, but really that's only a proportion of what you cover in med school. And I was actually surprised at how you end up covering a lot of kind of human biology and biochemistry, like the biochemical processes and physiology and things. You do end up obviously covering that. But there's so much more to a medical degree than just simply biology. So if you're worried that there's going to be loads of biology in the course, it's not all biology. There's going to be pathophysiology, there's going to be a lot of physiology as well, so about kind of how the body actually works itself, and you'll have like physiology classes. So one of my A levels was actually sports studies, and it was really strange that I thought actually there was so much from my sports studies A level that was in medicine on my uni course. So loads of words were coming up, and I was just like, oh, I've covered this already in my sports degree. So which is really odd that I was coming across more phrases in my sports studies lesson than biology at some points. So it really is not all biology if you're worried about that. There is lots more to it. There's lots of patient contact. If you, at some universities, they like start clinical skills from day one, examinations. It really is, there is so much more.
Okay, and then we'll probably have this as the last question just for the time.
Yeah.
Was it difficult to transition from A level to degree level? And how did you have to kind of adapt your learning and working for that workload?
Yeah, that's a really good question, actually, because I think a lot of people sometimes struggle with there is a jump. And I think for me, I thought it was a jump for levels of content. And I've mentioned it before. I didn't always find it difficult to understand the depth of things, but that was me personally. But I struggled then to remember things because you were going over things and then actually you were moving on really quickly to the next thing because there was loads of other stuff to cover. So I had to change because I used to just kind of like highlight things in A level and read things, and that worked for me because you could read it over and over and over again. But actually you couldn't always do that with medicine, with the content level. So I ended up making like flashcards and like mind maps and things like that. So I changed the kind of style of my revision and style of my learning. I listened to things. There's loads of stuff. There's loads of like YouTube videos and stuff like that now if you're quite a visual and auditory learner. So just find the best way that you learn, and then kind of you might have to end up changing it towards that. Like flip cards work quite well for me because I can look at it and be like, okay, I understand that. Next one. Look at that, read it over, go over in my head, next one. But you do have to end up being a lot more organized and getting through things and kind of really keeping on top of things because of the levels of content.
Okay, excellent. Again, with time, we're probably going to wrap it up there in terms of questions.
Yeah, I'm so sorry. We normally have like an extra 15 minutes, but I'll be so late for work.
Thank you so much for your time. We really appreciate you doing this just before you go onto a night shift as well. Like that's amazing.
13 hours.
Yeah, to throw a webinar on top of that as well is yeah, huge thank you. I hope the students kind of really enjoyed that and learned things from this as well.
I hope so, yeah.
So yeah, good luck with your night shift tonight, and I'm sure we'll see you again on some webinars soon.
Yeah, definitely.
Right, okay. We will send a copy of this recording out to everybody, and we'll put a copy of the slides on there as well. If you want to go and sign up for any more of the webinars, they're all completely free again. The next one that we're doing is in 2 weeks' time, and that's about hot topics within the NHS. So if you've got interviews coming up, they're the hot topics that might come up at interviews. So go and register for that one on the website, and hopefully we'll see you in a couple of weeks. But yeah, well, thank you very much for joining us, and we'll see you again soon. Thank you.